Hello, my name is Treasure. I'm from the Bliss Caregivers. So today we're going to be looking at a very broad topic called dementia. I would like you to know that as of March 2023, 55 million people have been diagnosed of dementia, and it will shock you to know that every year 10 million people are still being diagnosed of dementia. So then, what is dementia? Dementia is an umbrella term for loss of memory and other thinking abilities severe enough to affect one's daily life. Dementia is not a singular disease, rather, it is an umbrella term for a collection of symptoms that a person will be living with that has to do with an abnormality of brain function. Now, let's look at the signs and symptoms of dementia. Symptoms of dementia can vary greatly. Examples include problems with short-term memory, problems with driving around familiar places, inability of a person to um, inability of them to be able to know where they keep their purse, able to keep track of their wallet, inability of them to make some decisions, inability of them to retain even the short-term memory. Yes, there are other symptoms of dementia, and the symptoms are progressive. It may start as mild before it gets to being severe. They don't just that brings us to the stages of dementia, which we will treat as we go on. Now, let's look at the causes of dementia. There are several causes of dementia. First of all, the first cause of dementia is excessive drinking, excessive alcohol intake, excessive smoking. Another cause is um, inactive lifestyle, also known as sedentary lifestyle. Another cause can be excessive use of medication and its side effect. There is also another cause which has to do with deficiency of some essential vitamins in the body. High blood pressure can cause dementia. Depression can cause dementia. High blood sugar can cause dementia. Inability of one to involve in regular exercise can cause dementia, amidst several others. Now let's bring us to the types of dementia. There are several types of dementia. There is the Lewy body dementia. That has to do with a deposit of a particular type of protein in the brain, thereby affecting its function, leading to some dementia functions. Another type of dementia is vascular dementia. Now, vascular dementia has to do with a clot of blood in the brain. Mind you, blood vessels supply blood to different parts of the brain. Now, when you say vascular dementia, it has to do with a clot of blood in a particular blood vessel or blood vessels in the brain that supplies different parts of the brain. There is what we call frontotemporal dementia. Frontotemporal dementia is a deposit of abnormal protein in the frontal and the temporal region of the brain. There is also what we call Alzheimer's disease. Now, Alzheimer's disease is one of the most commonest form of dementia. When we say dementia, most times it is Alzheimer's disease because it is one of the most commonest form of dementia. Then there is mixed dementia. Mixed dementia has to do with collection of all these types of dementia, maybe not all of them, some of this type of dementia that I have mentioned. Now, let us look at the prevention of dementia. We've looked at the causes, we look at the types, we looked at signs and symptoms. Now we're going to be looking at prevention. How can we prevent this dementia? Now, in preventing dementia, we would like to look at lifestyle changes such as eating healthy, that is engaging in healthy eating life patterns, right? Then we're also going to be looking at reduction in smoking and drinking indulgence. Yes, if possible, stopping it in total, because whatever we engage ourselves in while we are young, it's what we tell on our old age. Because I would like you to know that dementia affects people from 65 years and older. Mind you, this does not mean that every old person has dementia, and it does not mean that anybody 65 and above will have dementia. Not everybody are prone to dementia, so that is why how you live your life, what you indulge in, matters a lot. Yes. So, in looking at self care for dementia, one will need to visit the doctor regularly for regular checkups so we can rule out hypertension, diabetes, and every other ailment. Mind you, dementia, like we said before, is not a singular disease itself. It is an umbrella word for different kind of symptoms that has to do with different kind of diseases, which we mention some of them. So if you go to the hospital regularly for regular checkups, it will make your chances for having dementia when you are old very slim. Also, engaging in activities that will stimulate your brain. Activities like games and other activities like games such as puzzle, Scrabble, etc. Brain games that will cause your brain to be active. Yes. Aside this, there are other things one needs to do. Like I said, quit smoking. Then also regular exercises can also help. Then being physically active, participating in activities that will stimulate brain function. Thank you very much. I hope you enjoyed this video. See you again in our next video. Please like, share, and subscribe to our channels so that you get notification when we post a video. See you. Bye bye.